care. First, getting the skills that you need to practice pulmonary and critical care medicine, and I would say without a doubt, those skills are here. The ability to do procedures, to run patient family meetings, to interact in a team environment where we have nurses, nurse practitioners, respiratory therapists, and all these different people who are coming together to take care of patients and have a little autonomy and ability to make decisions about what sorts of things to do for the patient on a daily basis. Those were things that I found very valuable in my training experience, and that's certainly what we try to provide for our fellows here. The other part of training is just recognizing that critical care intense is in the name of the field. So a good training program recognizes this and looks out for their fellows as well too, and make sure that fellows are doing well, that they are that they feel fresh, and despite working long hours, that they feel fulfilled at the end of the day, and making sure that we're in constant communication with the fellows to make sure that they're getting a good experience, and if something is not working that well, that we can change that, and they have the ability to make that change. We're a small sort of community, and we get along with each other, we like each other, and we care about each other. And I think that the best training environment is one that stimulates you academically and also fulfills you personally. And I think without question, our fellowship program provides that for our fellows. My name is Taison Bell, and I'm an intensivist in the medical ICU at the University of Virginia. A lot of common reasons to need to come to the medical ICU are you need frequent monitoring that can't be done on the floor, or you need special machines that can help support organ function. I was a sick kid growing up. I grew up in Lynchburg, Virginia, actually just an hour south of here, and I had really bad asthma. And one of the things I did pretty early on was immunotherapy, where I went into the doctor's office every week to get allergy shots. And I remember just being in the environment. The doctors, the nurses, people were very friendly to me. And I told them at a really young age that I was interested in being a doctor. And that's what kind of incited the dream pretty early on. And then I just held on to that. UVA has a really unique combination of really high-powered medical care and research and discovery. I really enjoyed the small town aspect of Charlottesville, and I think it enhances performance on the medical delivery side, but also outcomes for the patient. And I think that's one of the reasons why coming to the University of Virginia is a good decision, because you're getting high quality care delivered in a team aspect. And I think the intrinsic parts that make a team work really well are present here just naturally, just because of the environment.
Ladies and gentlemen, welcome back to Spotlight Over the City. And we have an amazing guest today. Actually, we've tried to keep you guys informed. As you can see, we have doctors that come on, very important positions that they're playing, frontline positions, very, very important positions. And we like to have doctors that come on to keep us as informed as possible as a unit, as a community. So it's a pleasure to have this young man on, because he is a frontline doctor, very important position that he's playing. And he's
absolutely
front and center. Actually just left the scene, so we'll let him talk a little bit about that. I'll let Wifey introduce our doctor. We want to make sure he get all his accolades and stuff, because these are our superstars and heroes today.
Yes, they are. And we have a superstar. We call everyone who is in the medical field, in the teaching field, those are like heroes to us, right?
Yes.
If you're a teacher, if you're in the medical field, you are our heroes. And we have today Dr. Taison Bell joining the show. You all, let's give it up.
Give it up,
please.
give it up, give it up. Thank you for joining us, Doc.
Yes, thank you, Doc, for joining Spotlight Over the City. We always like to tell people you are a part of our Spotlight family now. So welcome to our show. Yes, he comes with lots and lots of accolades. He is the assistant professor of medicine, of infectious disease and pulmonary critical care medicine at UVA. Did I get that right, Dr. Bell?
That's right.
You are the director of medical ICU, Director of the UVA Summer Medical Leadership Program, co-founder and co-CEO of Owl, like a hoot hoot owl, Peak Labs. You saw me do that, hoot hoot like
Yeah,
an owl.
I see, babe. You did that.
Yes, and so welcome, Dr. Bell, to Spotlight Over the City. Why don't you start by, let's just get right to it. You're out there on the front lines down there
Yes,
in
front line.
UVA, and let our audience and viewers know how things have changed in your life, both professionally and personally, since this coronavirus pandemic has haunted all of us.
Yeah, sure. And thank you all for having me. First off, I have a lot of respect for what you all are doing, trying to get the word out. It's really important. And I do work for the University of Virginia, but I'm here first and foremost as a physician, husband, father, and a member of the community. So I just want to get real information out there and get it to people. This is a virus that we should take seriously because it's causing a lot of problems and disease and suffering in the Black community. A lot of reasons behind that. A lot of it has to do with structural racism, chronic conditions that a lot of our community has. But we've seen that in the Black community, particularly, this disease has hit really, really hard, much more so than any other community. And me and other colleagues across the country are seeing this front and center. And we want to make sure that we get the word out because the name of the game is to try to prevent it. If you're ready, you don't have to get ready. If you're prepared, then you're good to go. If you're doing the right things and you can decrease the chance that you can get infected, keep yourself healthy, and we can see ourselves on the other side of this. So I just came from a shift at the University of Virginia taking care of patients in our intensive care unit. I'm triple certified in internal medicine, infectious disease, and critical care. But most of my job is in critical care. And people are getting sick from this. And it's, the advice out there from experts about washing your hands, the social distancing, wiping down things when you come into your home, trying not to touch your face. Those are very, very important. So I'll just give an opportunity to ask or have any questions that are out there asked so you can get good information.
Listen,
Wow. Well, first I want to just say thank you for all the hard work that you're putting in because I know it's stressful and strenuous and you have your own life and your own family outside of taking care of other people's family members. So I know that that's a critical situation for you as well. So thank you for that.
Dr. Bell, what are your thoughts about this whole social distancing thing? Do you really feel like it's overkill, overplaying? How you can contract this? Do we 6 feet, 3 feet? Like, is this really important or not? What is your opinion about that?
All right, good question. So let me tell you why this actually is really important to do. So first off, this virus can transmit without you having symptoms. You could either have mild symptoms, meaning you don't feel like you're that sick, or sometimes you can even not have any symptoms at all and pass it on. When someone coughs or sneezes, you can look on YouTube and look at videos of it, but a lot of droplets come out of your mouth. They spray everywhere. It's really disgusting, but they tend to not go farther than 6 feet. So if you're able to stay that distance from people, you can be relatively sure that if someone sneezes or coughs, or if they're, just from, talking or breathing, that those particles that come out of their mouth or their nose that could be infectious aren't going to get to you. Okay. So that's why it's so important to do that. In addition to wearing a mask, which protects others from virus that you may have in your mouth or nose, get on to others. This is a virus that we talk a lot about it like the flu because it's spread in a similar way, but it's more deadly than the flu and it spreads easier than the flu. So that's why we have to be really, really careful about adhering to social distancing, at least for the time being, so that we keep ourselves healthy.
From a medical professional perspective, what is your take on what we're hearing in the media now? I don't believe everything I hear in the media. I just want to preface that by saying that, but we're hearing a lot about Blacks being impacted more severely than any other, race. How true is that? Or again, I don't know if you can state it factually, but you can at least give us your medical expertise about that.
Not only how true, but also, if so, how come, in your opinion?
Exactly. So it is absolutely true that this virus is hitting the Black community way harder than other communities. I've been a part of a call led by other friends at the University of Virginia. I'll give you all their names: Dr. Hilton, Dr. Leanne Webb, Dr. Cameron Webb. And we've been calling for the CDC and other public health agencies to release the data on how race has been impacted by this virus. And we've slowly gotten some data released. We've got the public health departments of close to 50 states, or 25 states rather, release data. And what we're seeing is, out of a study of 14 states, or 25 states, where African Americans make up 14% of the population studied, so that's 14 out of 100, you're seeing people die from the African American community 3 out of 10. So that's more than double of what we would expect. Now, why is that? So let me just correct the record that it's not anything about being Black that makes you more susceptible to the virus. There's nothing genetically about us. Being Black is beautiful. It continues to be. But what plagues our community are higher rates of chronic conditions that make you more susceptible to having the virus. And those are conditions like high blood pressure, diabetes, kidney disease, and heart disease. These diseases are more prevalent in our communities than our other counterparts. And a lot of that is linked to poor access to healthy foods, poor access to health care, racial discrimination, structural racism. You can go on and on and on. But before COVID happened, our community was suffering more from chronic conditions. And because COVID preys on those chronic conditions, you're that much weaker coming into this illness. And that's why we're seeing so many more African Americans suffer from COVID disease.
Wow,
Gotcha.
wow. Vaccine. Let's talk vaccine. Talks of this vaccine is being developed in maybe a year, or a little over a year, when it's been known in history that it takes 5 years sometimes to develop a vaccine. What is your take on this vaccine, and when it becomes available, are you going to get it yourself?
And how safe would it be for us, as far as people not really knowing about vaccines, and they haven't really served our community well in the past, in my opinion? I don't really feel comfortable with the vaccine personally. I just want to know your opinion from a doctor's standpoint. And your
Sure. So I'm an infectious disease doctor, and I believe in vaccines. But let me tell you why, and why I think it is going to take longer than a year. Before a vaccine goes on the market, it has to go through a rigorous set of clinical tests to make sure that it is safe and effective for the community. It's the ability to make a vaccine to target something is not as hard. What is hard is making sure that it doesn't cause harm to people. So you have to go through a series of tests, and there's 3 major steps. So there's a phase 1, a phase 2, and a phase 3. Each phase you're looking at something different. Each phase you're looking at more and more people, and that takes time to do. So just developing the vaccine is going to take some time, several months. And then testing, it's going to take several months on top of that. So I don't think we'll have a vaccine in the next year or so. Most people think it will be sometime after that. But I do have hope that we'll have a vaccine out there. I'll be first in line to get it, just because of what I've seen from this. Because once something is available on the market, most of the time that's been tested in many people. I'll be honest, I'm not going to sign myself up to be one of the first few tested, but I am going to make sure that once it goes out onto the market, that it has gone through that rigorous process, and it is safe and it does work.
Okay, well, do you have any other tips for us that are healthy and have a healthy status right now to maintain that? Obviously, I'm going to still be around my husband and, my parents and my children, but any other tips for those of us out there who are healthy right now, and how we maintain that health status?
Exactly. So 3 main principles. So that's hygiene and doing it the right way. Washing your hands for 20 seconds with soap and water. So watch a video on YouTube on how to do that properly, because it does take some time to actually scrub your hands. Luckily, the virus does not survive well on surfaces after you clean them. So you don't have to have bleach or anything super strong. Just soap and water will do. But you have to scrub properly. The social distancing concept that we talked about, that's also very important. And if you are living with someone in the household who is sick, you want to try to isolate them. Okay. That's not always possible. We all live in different situations, but as much as you can, try to isolate if you are sick or someone in your household is sick, so that you can try to limit the spread. We have big families. Our community is all about family. And we have much more family than who lives in our household or in our neighborhood. And one of the things I stress with people is that social distancing doesn't mean that we don't care about each other. I think the better term is actually physical distancing.
Yeah.
We're physically farther from each other, but we can still make tight bonds with each other by doing things like this, by talking to each other, picking up the phone, calling a relative or a friend you haven't talked to in a while. Even in the midst of being locked down at home and not seeing people the way I'm used to, I've been able to connect with friends and family in ways I hadn't before. So just stress that taking care of each other means it doesn't mean that we can't do it even if we can't be physically close. That we can do it in other ways, and we all need to support each other to get through this.
That's right.
So from a personal standpoint, how are you dealing personally as a man who has a family, has to come home from this situation daily, frontline? How are you coping with this between home and work?
Yeah, so honestly, I'm upfront and out there about what I'm going through and what I'm seeing. I talk with my wife every day about what's getting me down, my struggles, my victories, similar to what I've seen your relationship, that you share everything with each other. The tendency for healthcare workers and just Black people in general is that we have barriers. We're going to crush them. We're going to get through them, and we may not be as good about talking about what we're going through because of that, because we're just used to dominate whatever comes our way. Yeah. But it is important to do. I saw on the Facebook page a mental health break or a mental health check, just to make sure that you're upfront about what you're going through. So today, I finished a 34-hour shift working in the ICU. It ended pretty badly. I came home. I told my wife about it. I told my family about it, just because I don't want to shoulder that just by myself.
Yeah.
They don't understand what I'm going through because they're not in the hospital, but they do know how it affects me. So it's important to remember this is a marathon. It's not a sprint. And we've always relied on each other to get through. It takes a village to raise a child. It also takes a village to sustain a man.
Yeah.
So I live that concept out, and I put it out there.
Wow.
I really like what you just said. It takes a village to sustain a man. I don't think a lot of people understand that, but it really does take a village to sustain a man, especially in your position. And so I just want to congratulate and salute you for the strength and the tenacity that it takes to every day wake up knowing you're facing an impossible almost task to resolve some of the issues that you face. It's almost impossible, but you stand in the gap every single day, and you still come home and be a husband and a family member. So we appreciate you here at Spotlight, and everybody like you. We just want to say thank you and salute to you guys.
Absolutely. Before we let you go, Dr. Bell, before we let you go, just on a lighter note, share something, that you have been able to do at home with, yourself or your family that's on the fun, lighter side during this quarantine. Like, what have you all done, if anything, to make this fun and make it not so...
To bring some normalcy, right?
So I'm going to get in trouble for this one. But one of the things that healthcare workers, a lot of us have been doing when we get home is that we take off the clothes that we've been working in and leave it in the garage or on the driveway before we come into the house. So I'm in a routine now where I get home, I strip down just the boxers, and I come to the house to say hi to the family. And my daughter, who's 2, says, "Daddy, you're naked." So it makes it a little light, and I go upstairs and take a shower, and then I come and give them hugs and kisses. But this has been going on for weeks now, and she says the same thing every time I walk in the door. And just,
I love it.
Just reinforce you.
Yeah.
That love is important.
So it kind of brings an enlightenment to the whole situation because it's a new normal for the day anyway.
Yeah.
And so for a child, they still not looking for that new normal. They have a normal that's normal. And so, it reminds you of where we are, right?
Most definitely.
Exactly.
Yeah, but I thank you for that. And we wish you all well.
We do.
Much prayers to you. May God cover you and your family continuously. And keep us posted.
Yeah, keep us posted. And if ever you need to get a message out, Dr. Bell, anything going on, you got a special project, anything like that, we consider you family once you've been on our show. So you let us know, and our platform is always here for you.
Exactly.
All right, it's been a pleasure. Thank you for having me.
Thank you so much.
Be safe.
Be safe.
All right, you too.
God bless.
Okay, thank you so much. Coming up next after this quick commercial break,